Hey, good afternoon. I'm Ed Merrens. I'm the Chief Clinical Officer for Dartmouth-Hitchcock Health. And joining me today is Dr. Antonia Altomare, the Head of Infectious Disease and International Health here at Dartmouth. We are here today to share the latest information about the coronavirus known as COVID-19 and Dartmouth-Hitchcock's response to it. First and foremost, we have to say that Dartmouth-Hitchcock Medical Center and Dartmouth-Hitchcock Health across our system are open and safe. There's been no disruption to the quality patient care that we provide. We have indeed confirmed 2 patients that have tested positive for COVID-19. I want to talk a little bit with Antonia around what happened with the patient and this process of quarantine and why it's important.
Sure. So we had our first patient arrive into our ambulatory clinic, and the processes we have in place to screen for at-risk patients worked. We worked very closely with the State Department of Health to ensure that we were appropriately testing for what we needed to test for. And within 48 hours, we had confirmation that this patient indeed had COVID-19. What we needed to do at the time that we got this information was determine all the people who could have been in close contact with this confirmed case and get them into quarantine. Quarantine, the definition of that is putting people who are not infected in private space where they too could not potentially infect others should they become symptomatic. What we know about COVID-19 is evolving every day, and we know that you could be infectious before symptoms develop. So the idea of getting people quickly out of public space is important because we never know when they will develop symptoms.
With the people that are infected, we've done a lot of what's called contact tracing. People that have been in contact with them, close by, touching, and asked these individuals to quarantine at home to reduce any chance of interacting in the healthcare environment. But these people are asymptomatic. They are not exhibiting any form of disease, and we're working closely with the state and abiding by CDC recommendations.
What you should know is that we are very closely monitoring with the state all these individuals in quarantine, and as they are becoming symptomatic, we are getting them tested right away. And that brings us to our second case that has tested positive in the state. We know for sure this case was a close contact to our first case, and we believe that we have all these contacts in quarantine to prevent any ongoing transmission.
The other important thing that everyone should know is that travel has been a big part of this disease. We're aware that this started in Wuhan in China and has rapidly spread really around the world. Our initial case was a travel-related case, but our second case was one that resulted from contact with this individual. And this is similar to other cases that are around the United States, and we expect to continue. We are very conscious of travel, and we have continued, and it really had a pretty consistent message when people show up for appointments around, have you had foreign travel, have you had any symptoms, we've had countries at risk, and it was by this process that we identified the first case and were able to deal with it so quickly and in coordination with the state.
What you may be seeing now and recommendations we are putting forth to our populations is if you have had any travel to what is categorized as a level 3 country travel restriction by the CDC, and these countries are constantly changing and being updated, we ask that if you are within the 14-day period of return from these high-risk countries, that you consider rescheduling any elective or non-urgent appointments so that we can make sure that we are not continuing to expose our community and our staff here at Dartmouth-Hitchcock.
I think people are worried, and we should also remind everyone that this is a time of year where there are other reasons to get sick. There are regular cold viruses, and we have active influenza in our community and across the United States. The precautions that we've talked about for COVID-19 and others is hand washing and other measures to prevent the spread of disease. I think what a lot of people are worried about now is getting tested, and we've received a lot of questions and calls from people wanting to get tested. What we do know is that in the asymptomatic state, we can't test for this disease, and just because you have some symptoms or know someone or someone has traveled, we can't test everyone, and we're really working closely with the state to test people that we think are most at risk.
At this point in time, we do not have any evidence that we have widespread community spread of this infection of COVID-19, but we know for a fact we have widespread infection of influenza and other respiratory viruses. So I do think it is important that you stay calm and you speak to your provider. It's best if you call and not show up, just in case you do have any risks to be concerned about. And talk to them about your symptoms, talk to them about your travel, talk to them if you think you may have in fact been a close contact to a confirmed case of COVID-19. If you are sick in any way, you should probably refrain from visiting your loved ones in the hospital. It's very important to keep them as safe as possible. We don't want them getting influenza on top of anything else that they're in the hospital for at this time. So we are asking that visitors who are ill to please refrain from coming to visit if there's no urgency to come to visit. If you are ill and you need to come, then by all means we want you to be able to come. We ask that when you enter the building, you make your way to the nearest information desk or reception desk to grab a mask and put that on so that we can protect everyone that's here at Dartmouth-Hitchcock. Know that if you have questions, we have several outlets for which you can get information. One is our COVID-19 hotline, which you can call. There's a recording with some information on there. The number is 603-650-1818. We also have a constantly updating FAQs available on our internet site. And the Department of Health also has inquiry lines for other questions. Know that the CDC is constantly updating their website, and questions can be sent directly to social, that's SOCIAL, at hitchcock.org.
So I think the other thing is that this is the first briefing of what we think is going to be a daily update. We will be back. We may bring others, but we plan on continuing the communications as being really a vital part of us coordinating our plans with all of you, and we look forward to bringing you more.
And know that our primary concern in all of this is keeping you and our staff safe, and we will continue to do so.
Excellent. Thank you.